Often we overwhelm families, I think, with first of all the news that your child has cancer. We've figured out what kind it is, and here are your treatment options that we're going to recommend, and we're going to come back tomorrow or later tonight and tell you that you're going to have to make a choice. That's overwhelming. But what it means is that they have to be in a place where they can rely on the fact that the medical expertise in that institution, first of all, is state-of-the-art. Second of all, is multidisciplinary. And third of all, that the practitioners, the providers that are going to care for your child are going to be ones that won't stop at just what their beliefs are, but they're going to continue to research and talk to their colleagues and work around the country and around the world sometimes for the best treatment options. I think when choosing a physician or a medical care site, it's really important to know that they feel that they're getting the best care available. And that in pediatric oncology and childhood cancer is to enroll on a clinical trial if there is one available. What we have shown over successive generations of studying childhood cancer is that children who are enrolled in clinical research trials to evaluate important questions about what drives leukemia, how to treat it best, how long to treat it, which drugs to use, children who enter clinical trials do better than children who don't. Now, sometimes there isn't an available clinical trial, and that's perfectly okay, because at a strong academic medical center that's going to provide state-of-the-art care, those clinicians are going to know what the best available care to date is, and they're going to deliver that. I think one of the things that I'm most excited about our group here is that we can offer that. We have world-renowned experts in these diseases. Our current generation of clinical trials, one of which went into leading the backbone of all of our modern therapy, was sponsored and led by Dr. Kelly Maloney here at Children's. There are kids on that trial that have a 99% chance of being cured. That's what we get by cooperating, by studying, by researching, by enrolling kids in clinical trials, and by working together to get those best outcomes. Our goal in every case is to cure a child, and we're going to approach our therapeutic recommendations with the best honesty that we can, with the pursuit of trying to meet the family's goals. If you are collected at a center like this, where every single person in the building wants that kid to get better, odds are we're going to be able to work with that family to figure out what the best outcome can possibly be for that individual child.